Hello, I'm Joanne Hoertz, Senior Vice President of Nursing at Brooks Rehabilitation. I'm very happy to welcome you back to our skilled nursing and assisted living campuses. We're so excited that the Governor has removed the restrictions for visitation and provided us with some new direction for how to coordinate visitation in our skilled nursing and assisted living facilities. Today, I'm going to review with you some infection prevention and control principles that's very important we abide by whenever visiting our loved ones in our facilities. Infection prevention and control allows us to prevent the transmission of disease and the spread of disease from person to person or from area to area. Germs are viruses, bacteria, fungus, and they can easily be spread from person to person. They can be found in the air, in the respiratory system when you're breathing, in food. Bacteria can be found in water. Bacteria can be found in other body fluids. Today we're specifically going to focus on coronavirus transmission and how to prevent the spread of coronavirus. There's 3 basic infection prevention principles that we want to keep in mind while visiting your loved ones here on our campuses. The first is hand washing and hand hygiene. Hand washing is critical and the #1 way to prevent the spread of infection and germs. When you're washing your hands, you want to be sure that you're washing your hands for 20 full seconds. You want to get your hands wet with water, get some soap, and begin rubbing your hands for 20 seconds. You're going to rub the front of your hands together, the back of your hands, getting in between your fingers, both sides. Be sure to get on your thumb and around your thumb. Pinch your fingers together, put them in the palm of your hand and rub to really thoroughly clean your fingertips, both sides. Be sure to get the wrist. 20 seconds is important because it's the friction that removes the germs from your hands. After 20 seconds, rinse your hands, grab a paper towel, turn the water off, dispose of the paper towel after you've turned off the water, and be sure to then dry your hands. If you can't wash your hands with soap and water, and again, if your hands are visibly soiled, they need to be washed with soap and water, use alcohol-based hand sanitizer. Same rubbing process. You're going to get your hand sanitizer in your hand, rub your hands together, back of your hands, fingertips, thumbs, and wrist, and let the hand sanitizer dry. Don't wipe the hand sanitizer off of your hands. The second infection prevention principle that we want to talk about is social distancing. Social distancing is very important to also prevent the spread of germs. We need to maintain a 6-foot distance away from other people, other residents, and really when you're visiting, keep the social distancing in mind and try to stay 6 feet away. Particularly for general visitation, the 6-foot distance is important. There are 3 different types of visitors. There's compassionate visits, there's general visitation, and essential caregiver visits. In compassionate visits, there may be times where you need to be closer than the 6-foot distance between you and your loved one. We understand that, and we do appreciate the fact that there will need to be some times that you are closer to your family member. Please make sure that you try to maintain distance as much as possible. The third infection prevention principle is wearing the procedure mask. These are the masks you'll be required to wear while visiting at our campuses. When you come into the building, we will provide you with this mask. At all times, your nose and mouth must be covered by the mask, and at all times, you must wear the mask while visiting. We are encouraging and really helping our residents to wear a mask during your visit, as well as you wearing a mask during the visit. This will help also to reduce any kind of spread of disease or infection. There is a handout that you'll be receiving to talk about the do's and don'ts of wearing your mask. Things to consider is not to wear your mask around your neck, don't wear your mask around your forehead, and don't be touching your mask. If you do touch your mask, be sure to grab some hand sanitizer and clean your hands. There may be times when you are required to wear additional personal protective equipment besides just the mask. These would be an isolation gown and gloves. If you are required to wear an isolation gown and gloves, the staff will let you know and they will assist you with putting on this personal protective equipment. This short video clip will show you how to apply and wear a gown and gloves.
How to safely put on personal protective equipment, or more commonly called PPE. We will demonstrate one way to appropriately put on or don PPE. More than one donning method may be acceptable to your facility. It's important that you receive training, demonstrate competency, and practice your healthcare facility's donning procedure. First, identify and gather the proper PPE to don, including an appropriately fitted isolation gown, a face mask, a face shield or goggles, and a pair of disposable patient examination gloves. Perform hand hygiene by using alcohol-based hand sanitizer or washing your hands with soap and water for at least 20 seconds. Put on the isolation gown. Tie all ties or snap all snaps. You may need assistance from another healthcare provider. Put on a face mask. Extend the face mask under your chin, protecting both your mouth and nose. If the mask has loops, hook them around your ears. If it has ties, secure them at the base of your neck and crown of your head. Next, put on a face shield or goggles. Lastly, put on your gloves. Pull the gloves down so that they cover the wrist of the gown. You are now ready to enter the patient's room.
When removing our personal protective equipment, it's important to remember the sequence that we take gowns and gloves off. This video clip will demonstrate that sequence. You'll always remove your gloves first, and then your gown, and then perform hand hygiene.
How to safely take off personal protective equipment, more commonly called PPE. We will demonstrate one way to appropriately take off or doff PPE. More than one doffing method may be acceptable to your facility. It's important that you receive training, demonstrate competency in removing your PPE without contaminating yourself, and practice your healthcare facility's doffing procedure. Remove and discard your gloves. Gloves can be removed using more than one technique. For the glove-in-glove technique, pinch the outside of the glove near the wrist. Peel downwards, pulling the glove inside out. With your ungloved hand, slide your finger under the wrist of your remaining glove. Again, peel downwards, turning the glove inside out. Discard the gloves. For the beaking method, pinch the outside of the glove near the wrist. Using your finger, pull the glove inside out and over the fingers and thumb to form a beak. With the beaked hand, pinch the opposite glove at the wrist and pull downwards, turning the glove inside out. With the ungloved hand, pull the beaked glove off, touching only the inside of the glove. Next, remove your gown. Untie all ties or unsnap all snaps. Some gown ties can be broken rather than untied. In that instance, break the ties gently, avoiding a forceful movement. Reach up to the shoulders and carefully pull or roll the gown down and away from the body. Dispose of the used gown. You may now exit the patient's room. Perform hand hygiene by using alcohol-based hand sanitizer or washing your hands with soap and water for at least 20 seconds. Be sure to clean your wrists where the edge of the glove was located. Carefully remove the face shield or goggles by grabbing the strap and pulling upwards and away from your head. Do not touch the front of the face shield or goggles. If you are wearing a face mask, Carefully untie the straps or unhook them from your ears and pull the mask away from your face without touching the front of the mask. Lastly, once again perform hand hygiene after removing the respirator or face mask. You have now completed the doffing procedure.
When you came into the building, you were screened for signs and symptoms of coronavirus. Signs and symptoms of coronavirus include fever, coughing, shortness of breath. Other non-conventional signs and symptoms include headache, sore throat, loss of the sense of taste or smell, general malaise, body aches, chills, fever, shaking and chills. If you develop any of these symptoms within the 14 days after your visit, it is imperative that you contact us and let us know. Please call the main number of the facility that you're visiting to inform us that you have a fever or any other symptoms of coronavirus. This will help us to track back any possible exposures if anyone does become sick following a visit. All visits need to be scheduled. Please continue to utilize the phone numbers that you've been provided to schedule future visits with your family members. Remember during all of your visitation, infection prevention. Wash your hands, wear your mask, practice social distancing. We're very excited to be able to start visitation again. We know it's been a very long time and a difficult time since you've seen your family members and loved ones, and we're excited to welcome you back into our campuses. Please remember to practice infection prevention and control techniques. And again, if anyone becomes ill following their visit, it's important to let us know. You'll now be able to complete a short quiz and will be signed off on your competency for visitation. Again, welcome back and stay safe.
Welcome back. We know this has been a difficult time, but we're so glad you're here.